This video is entitled Dual Scope Assisted Endoloop Resection of a Giant Esophageal Fibrovascular Polyp. Esophageal fibrovascular polyps are rare, benign, and non-neoplastic lesions composed of fibrous, vascular, and fatty tissue. They usually occur in adults between 15 and 70 years of age and are considered giant when larger than 5 centimeters. Although often asymptomatic, they may cause dysphagia, regurgitation of the mass, or even life-threatening airway obstruction. We present the case of an 86-year-old man with Parkinson's disease, trigeminal neuralgia, and bilateral hip prosthesis. Referred for progressive dysphagia and occasional oral protrusion of a soft and painless mass for about 1 year. Upper endoscopy confirmed a large, pedunculated esophageal polyp originating just distal to the cricopharyngeus. Given the patient's advanced age and comorbidities, a minimally invasive endoscopic resection was selected as a definitive treatment. Before starting the procedure, we show this schematic diagram, which illustrates how a second pediatric endoscope was used to assist the resection. Through this second scope, grasping forceps were introduced to hold the distal end of the flexible endoloop, making it possible to create traction and stabilize the lesion. This contraction allowed the loop to open and slip more easily around the polyp, facilitating its placement at the base of the stalk. Under general anesthesia and with endotracheal intubation, a conventional endoscope was first introduced. A giant pedunculated lesion, approximately 10 centimeters long and 2 centimeters wide, was visualized just below the cricopharyngeus. The distal part showed necrotic areas, and the mid portion exhibited ulcerations, likely due to the chronic torsion of the stalk. Initial attempts to place an endoloop at the base were unsuccessful because of the polyp's size and mobility. As previously shown in the diagram, a second pediatric endoscope was then inserted to provide countertraction and facilitate loop manipulation. With its assistance, the endoloop was successfully positioned and tightened around the stalk. Resection was then performed using a 25 mm hexagonal hot snare, cutting precisely at the base of the polyp. As the snare was advanced, with gentle torque movements toward the base of the stalk, it is worth highlighting why an endoscopic submucosal dissection or ESD was not selected in this case. The lesion originated immediately below the cricopharyngeus, a narrow and angulated region that limits visualization and instrument control. Performing ESD in this area carries a significant risk of perforation or injury to the upper esophageal sphincter. In addition, this was a giant, mobile fibrovascular polyp with a long vascular pedicle that moved with respiration and cardiac pulsations, making stable traction difficult and increasing the risk of bleeding during dissection. Given the patient's advanced age and comorbidities, our primary goal was to achieve safe and effective removal with minimal invasiveness. The dual scope assisted endoloop technique provided excellent control of the stalk, ensuring mechanical strangulation before transection and reducing manipulation of the cervical esophagus. This approach offers a faster, safer, and more reproducible alternative in high-risk patients. Once transection was completed, hemostasis was achieved by targeted thermocoagulation of visible vessels at the resection site. The specimen was retrieved intact with a rod net. A final panoramic inspection confirmed a patent esophageal lumen without bleeding or perforation. Histologic examination of the specimen showed that the polyp was lined by benign squamous epithelium and composed of a mixture of mature adipose and fibrous tissue. No evidence of malignancy or base involvement was observed. As a conclusion, the endoscopic resection represents a safe and effective alternative to surgery for giant esophageal fibrovascular polyps, especially in elderly or fragile patients for whom surgery is not suitable. The dual scope assisted endoloop technique provides traction and stability, enabling precise loop placement and secure resection with excellent outcomes.